If it doesn't hurt, it isn't working. We've all heard this about tourniquets. For a long time, we accepted that saving a limb meant crushing it. But does extreme pain actually equal effectiveness? According to physics, no, it doesn't have to. To understand why, we have to look at what's happening inside of your limb. My name is Hannah Herbst. I'm one of the inventors of AutoTQ, the automatic emergency tourniquet that stops bleeding with one button push. To understand why tourniquet pain doesn't equal effectiveness, we have to look at some of the existing studies and research about tourniquet physiology. All of the research and citations I refer to today will be in the caption of this video. When you apply a tourniquet, your goal is to compress the artery to stop blood flow. But there's more than just arteries underneath the tourniquet line that are being compressed. There are also nerves. Nerves are much more sensitive to pressure than blood vessels are. When you crush a nerve, you get excruciating pain. If that pressure is too high, you risk lasting nerve damage. This is where the physics in tourniquet design makes all the difference. Research by Dr. James McEwen and Dr. Massari points to something called pressure gradients. Think of a narrow tourniquet strap. It creates a high force. It's pinching and crushing the tissue directly below the tourniquet line. This creates a massive spike in pain, often before the artery is even closed and the bleed has even stopped. If you've ever applied a conventional tourniquet, you have felt the pinch before you've controlled the blood flow. Now look at a pneumatic system, like the ones used in orthopedic surgery or like AutoTQ. Because the cuff is wider and uses air, it's a squeeze, not a pinch. This allows the pressure to reach deep enough to control the artery while also drastically reducing the force on nerves. Studies show that wider tourniquet cuffs require less pressure to control bleeding, while narrow tourniquet cuffs require much higher pressure to control bleeding, which is why they're associated with so much pain. You can see more on our overview about tourniquet pressure in this video. When we designed AutoTQ, we poured over dozens of studies. We realized if we could optimize the width and pressure of the tourniquet, we could stop the bleed in emergency setting without causing excruciating pain for probably the very first time. AutoTQ uses two wide cuffs. AutoTQ's arm cuff is 3 inches, or about 7.62 centimeters wide, and the leg cuff is nearly 4 inches, or about 10.16 centimeters wide. AutoTQ targets the pressure needed for occlusion without the unnecessary force that can cause trauma. Don't get me wrong, a tourniquet is intervening with your blood flow. It's going to be uncomfortable. But the idea that it needs to be agonizing to be effective is a relic of the past. AutoTQ proves that we can stop the bleed smarter. If you want to learn more about how our team invented AutoTQ, visit our website at theautotq.com and reach out to us. We'd love to discuss these topics with you and would love to meet you.